It's exactly what Yemen's already overloaded medical teams didn't want to hear. A new outbreak of disease. A growing number of people have died with symptoms similar to bird flu. And doctors say dozens more could be infected.
When these patients arrived, they had influenza symptoms like breathing difficulties and acute respiratory failure. They also had a high fever.
Identifying the disease is challenging. Doctors are treating more patients with fewer resources. Standard supplies and testing kits have become a luxury.
These cases raise a red flag. They match H1N1 symptoms like fever, intensive coughing and headaches. But the Ministry of Health hasn't been able to confirm this. Since last year, labs don't have the supplies to test this.
The country is already dealing with one of the worst ever outbreaks of cholera. The International Committee of the Red Cross says there are more than 1 million suspected cases. And about 80% of Yemen lacks proper access to food, clean water, and health care. Cases of bird flu would only add to the crisis.
If we add to this formula more preventable diseases, then we are facing an extremely difficult, catastrophic problem in Yemen.
It's a fight doctors deal with on a regular basis. Yemen's 3-year war has made already dire conditions of disease and hunger even more difficult to combat.
We have more than 20 men, women, and children who die every day from preventable diseases. Why does that happen? Because more than 50% of the health centers and hospitals in Yemen today do not function anymore.
There are small signs of progress. In January, the UN allocated $50 million to support Yemen's humanitarian response. Some ports have opened, allowing for the delivery of food, supplies, and medicine, aid the country's hospitals desperately need. For many, the help has arrived too late. For others, there is still some hope. Katia, Lopez-Hodoyan, Al Jazeera.